A lot of people think family medicine is really just seeing patients in the office, and while a lot of us tend to go that route when we're done with residency, a lot of our training is a lot more broad than that, because essentially as the primary care doctors, we have to know everything.
Wright State University Family Medicine provides exceptional clinical training and also leadership, character development, and resiliency training. Also, we have a unique community focus where we care for the underserved and most vulnerable populations in the Dayton area. This includes refugee, clinic, team-based care, OB, and prenatal care, and just a lot of things that serve the needs of our community in a special way. Our graduates are prepared for anything they want to do, from community practice, including in rural areas, to fellowships in geriatrics, sports medicine, and palliative care, and leadership positions in the community.
Within the training of family medicine, a lot of the things that we do are pieces of all the other fields.
Throughout our first year, we get to do a bunch of different rotations, so we get to dabble in a bunch of different specialties. We do inpatient, which is focusing a lot on acute problems, but we also get to do a month of office, and we actually get assigned our own patients in a brand new outpatient center. The other things that we get to do are OB-GYN. You get to deliver babies. You also get to see a couple of other etiologies of gynecology, and you work with the OBs one-on-one and figure out assessment and plans for those patients. We also get to go to Dayton Children's and do some pediatric care.
We also have exposure to emergency department medicine. We do 2 ER rotations in our first year. We do 1 in pediatrics and 1 in adult medicine.
I think the important things about going to different rotations is you get different perspectives on what things you're supposed to be looking for in those different populations. When you're on, in the emergency department, you realize what things as a family doctor you should be sending over to be evaluated by an emergency physician and in that setting.
A lot of what we do first year is a lot of, especially the first rotation, okay, I now have responsibilities, how am I going to manage patients? The nice thing is, the second and third years are very supportive.
I remember when I was on my inpatient rotation and I felt really nervous being on call for the first time, taking the pager and the phone, but your seniors, the second and the third years, are there to back you up, and they're always there.
And then as first year progresses, it's more, okay, let's make that transition to now second year, where now we're sort of the ones that are going to have to foster the first year residents.
Our second year we'll spend time with orthopedics, ENT, dermatology, and we also have some time to build in what our personal elective are for a month. So for example, I did a month of global health, practicing internal medicine and hospital work in Africa.
Third year is more helping you to transition from being a resident to being an attending, because when you graduate, you'll be on your own. We kind of transition more to outpatient. So the more that we understand how to manage a patient in the hospital helps us understand how to manage a patient in the office.
During our third year, we get to do a little bit more elective time and rotate through a variety of specialties so that by the time that we're ready to graduate, we know a bit about what everybody does and when it is appropriate to take care of problems on our own in our office or in the hospital, and when we need to consult for others.
What I love about being program director and working at Wright State in the Family Medicine Residency is watching highly motivated, highly intelligent, and highly compassionate residents start in residency and then develop over the years to become full-fledged independent physicians. Many times I get to work with them and get to be friends with them in the community once they graduate, which is a special treat. And we're very happy with the impact we have in our community and look forward to having this impact and being here for many years to come.
In the journey to become a really good physician, a lot of it has to do with really how solid was the training. Here at Wright State University, our family medicine residency, we really do get a top-notch education. Coming to Wright State was one of the best things that I could have done for becoming a really good family physician. The training, the people, the experiences, they're second to none. And I really look forward to seeing how this program will continue to evolve and continue to train really strong physicians that make a really big impact on all the communities that they touch.